The purpose of the head and neck examination is to prevent cancer early or better yet before it happens. Today, Dr. Peña will perform the head and neck examination. To start off, she will prepare herself by making hand washing. Set up the equipment by applying the PPE and unit prep. She would have to review the patient medical chart information, and she will ask questions about having any surgery in the past, if taking any drugs or any medication. She will explain the patient procedures. We will now start with the exterior head and neck examination. Ms. Peña will now perform the mandible, chin, and jawbone. She will now show the anterior auricular lymph node in front of the ears. Next will be the posterior auricular lymph node behind the ears. The occipital lymph node is performed in the back of the neck. The temporomandibular joint is showing the jaw hinge movements that connects to the lower jaw to the skull. The parotid gland is a salivary gland mid-cheek. Now, Dr. Peña will show two separate parts in which are performed and almost in the same spot. These will be the submental lymph gland under the chin and the submandibular lymph gland under the chin. The sternomascetoid muscle is the large muscle side of the neck. The thyroid gland and larynx are done in the same position. She is now demonstrating supraorbicular lymph node next to the collarbone related to the breast tissue. After making an excellent job demonstrating of the exterior examination, we will now start with the interior examination. Ms. Peña will grab the patient's lips inside and outside. She will observe them. The doctor will now show the labial mucosa and frenulum, soft tissue inside the lips. After the available rigid gums and bone, top and bottom. Dr. Peña is proceeding the parotid gland duct or small opening mid-cheek. She will grab and hold the mirror to open and show the bottom gum tissue behind the second and third molar. The maxillary tuberosity on top gum tissue behind the second and third molar. The patient will lift up her tongue and show the floor of the mouth. Underside of the tongue, tissue, duct, and muscle under the tongue. The submandibular and submental gland is performed under the chin and tongue. Now she is demonstrating the lateral and base of the tongue, sides and back of the tongue. The doctor will palpate the dorsal of the tongue. Finally, Dr. Peña will close her examination by going through the hard and soft palate, roof of the mouth, the uvula anterior and posterior pillars, back of the throat, and the palatine tonsils and the posterior wall of the pharynx back of the throat.